Let's go back to one of our main stories now, and that is the KZN vaccine rollout. And we are joined by the MEC in KZN, Nomagugu, Simelane-Zulu. A very good afternoon to you, MEC, and thank you for your time. I want to ask you the question, how big a challenge is this rollout of vaccines in KZN right now? And I ask you this on the back of the comments that you made at the media briefing this afternoon, where you talk about herd immunity or population immunity facing a risk because of people who do not want to be vaccinated, included among them are healthcare workers. What exactly are the concerns here?
Thank you very much, colleague. Good afternoon to you and to your viewers at home. We do generally have a challenge in a sense that we have a very big province, and our province has a population of more than about 11 million people. Now, with the number of vaccines that we have received, obviously we have had to relook at our plan and how we are going to target and be able to roll out eventually to the whole province. So right now, the challenges that we are having, especially when it comes to health workers, is how do we make sure that all the health workers in the province, and we have more than 82,000, understand that at this point, because of the number of vaccines that we have received, we will not be able to actually vaccinate all of them at the same time as it has been our plan previously.
Yeah.
And you are correct. We have had a few instances where some health workers have decided that they don't want to be vaccinated. It's not a big number, I must indicate. However, because we have indicated through the minister and the president that everyone has a right to say no to the vaccine, and no one is going to be forced to vaccinate. Those that have refused to be vaccinated, we've had to have a session with them, try and cancel some of them. And out of that, we have found that 90%, after being properly cancelled, are willing to come back and be vaccinated. And we are quite happy about that particular process. The 10% or so that has not vaccinated will indicate religious beliefs and so forth. And others are saying they've not made up their minds as yet. So they've gone back, and we are busy re-talking to them and trying to make sure that we bring them on board, while ensuring that we balance the right of the person to say no and the fact that we have a challenge of the herd immunity that we must achieve. So that is the first challenge that we have. But I think we are getting over that particular challenge at the moment.
MEC, let me ask you to be completely frank with us and tell us about the number. I understand you're saying it's not big a number, but it is important nonetheless, the size of healthcare workers who do not want to take these vaccines because of certain misconceptions. You've already mentioned religion as possibly being a part. But the reason I would like for you to tell us exactly the number of these healthcare workers who do not want to be vaccinated is that how then do you stop them propagating their misconceptions to members of the public? Because if you're a healthcare worker and I'm an ordinary member of the public who definitely wants this vaccine, but you are saying, well, these are the issues around them, I might just be convinced not to take it because I trust your judgment as a healthcare worker.
No, that's very true. When we look at the numbers of the health workers that have not been very forthcoming, I mean, you've just indicated now that in the past 3 days, we've probably vaccinated more than 1,000 health workers. And of that, you will find that it's not even more than 5 people who've literally refused despite having been cancelled again. So of the 5, when you compare with the 1,000, it's really a very nominal number. But you are correct. People, when a health worker indicates or says has reservations against the vaccination, people will actually take that as something that is the gospel truth.
Yeah.
But what we have found to be in our interest and is working in our favor is the fact that those health workers that have decided not to be vaccinated are often very much upfront to say, look, my religious beliefs are A, B, C, and D. As a result, I will not be able to take the vaccine. And this is what they say to other people. But besides that, we have decided as the province that we need to have a very aggressive communication strategy that goes to the communities, that talks about the vaccine, that talks about the right of every person to be vaccinated. But we take it a step further and say no one has a right to dissuade you or to stop you from taking the vaccine. We are talking on the radio stations, we are talking on community televisions, we are talking on community radio stations. Xoli, we even take it a step further and we loud hail in our communities, we loud hail in townships, we loud hail in rural areas one day a week. I'm also part of that loud hailing. I go around with the team that loud hails. We go to the malls, we stand, because we also want to avoid people congregating. It's easier for us, instead of getting into a truck and talking, just to move around with a mic and a speaker. And that is what we have been doing for the past 3 weeks, because we want to counter that narrative in particular.
All right, MEC. And very briefly for me, finally, the third wave is something that you have been warning about incessantly. How many people, by the time the third wave reaches us, because you've also alluded to the winter period possibly being the period that we might get into that third wave, how many people by that time are you hoping as a province to have vaccinated?
By that time, we were hoping we would have finished the second wave, sort of the second phase of the vaccination. And the second phase of the vaccination is when you would then be vaccinating your frontline workers, not your health workers, because your health workers are on the first phase. But by then, we hope we would have vaccinated the frontline workers. We would have vaccinated those that are above 60. We would have vaccinated those that have comorbidities. But of course, that depends on the vaccines that we are receiving as a province and the vaccines that are received as a country. If I may also just indicate that we are right now working on an issue of ensuring that the GPs in the province also are getting the vaccine, and they get it on time, and they get it where they are supposed to be getting it on, so that all the health workers in the province have access to this particular vaccine.
All right, MEC, let me thank you very much for your time. That's the KZN Health MEC, Nomagugu Simelane-Zulu.